afternoon, everyone. I would like to say a big thank you to Dr. Napa that who actually invited me.
So we'll take questions after his presentation. Questions for both. Questions or comments.
Who actually invited me to speak briefly, anyway, on antimicrobial resistance. And I would like to also appreciate the presence of Director, Veterinary Teaching Hospital, University of Abuja, to be part of this awareness, and also other colleagues and senior colleagues that are present. From the first speaker, you will discover from his words that is already a menace, not only a menace, a pandemic now in the world. And it does not start just an hour ago, or 2 days back, or 1 week ago. It is something that has, been on a long time without being checked. And the word checked, that it was absent, actually predispose or bring about this resistance to microbial agents. Now, microbes we can look at them in classifications, but we will do that. Time might not permit us. We will narrow it a bit, and then we will touch little by little. Now, antimicrobial or resistance to antibiotics or antifungal or whatsoever is based on some practice in the clinics that are not done scientifically or are not done professionally. And most of the time, it's not that the antibacterial or antimicrobial agents to be used are not available or are not being used, but the indiscriminate use of these has brought so much confusion, even in the world today, that it's already becoming a pandemic. With my experience in the clinics over years, I like to say that one of the things that is actually cause this resistance is self-medication. Now, self-medication is not only found in the human, but today in the veterinary practice, it is all over. And then you just see someone who just check an animal, all right, this animal is diarrhea. And the next thing is to compound a lot of agents from nowhere, put it to stop diarrhea. And at the end of the day, you have not really isolated the causative agent. You have only tried to allow the causative agent to go to rest a bit. Thereafter, after some time, they come back more violently, not only as violent that they are before, but they come back more violently because you have tried to suppress them. They refuse to be suppressed because you are using wrong agent to attack them. Another one that might cause that is causing a lot of trouble in the clinics today is the wrong route of administration. Now, you know that once a drug preparation is being made and prepared, made available, whether over the counter or it's being made available, by prescription, wherever, by physician here and there, if you don't follow strictly the route of administration, you are encouraging resistance to a very large extent. For example, you are to administer a drug, an antibacterial and antibiotics drug, for example, intramuscularly, but you decide to go and say, no, I don't want to go through, I want to do some shortcut, and you went intravenously. You are just causing a menace. You are causing a menace, and this has been some of the problem and challenge, that is visible in the clinics. I'm saying this because even some that is expected to know what to do also cut corners. And I want to believe that with this awareness, cutting of corners will be suspended and will not be practiced any longer. Because at the end of the day, this resistance just came because the things that is expected to be done are not done rightly. And when you administer these drugs, you are expected to administer these drugs at a certain dosage. Now, dosage that could be compared to the weight of the patient that you are actually attending to. But most of the time, we just look at the patient and just think, okay, the patient is, for example, 5 kg. Why estimated 5 kg? Why the patient is actually 22 kg? And then you just decide and calculate your dosage based on 5 kilograms. That is gross under dosage. And it will not work. Number one, you will not get your result. Number two, it will lead to resistance. Another one to which we'll quickly look at is in the clinic is very common. Once you get your patient, you will like to clap or you do physical examination. Now they are the same in the human area. They do clacking, but we in veterinary medicine we actually do physical examination. Now, as you take out this process in trying to check some vital physiologic parameters, after stabilizing whatsoever, you can pinpoint 1 or 2 things that might be the challenge with your patient. Now, the right thing to do to stop this menace of of resistance is to actually take the correct sample to the right laboratory for analysis and wait for the result to come before you can institute correctly. However, you might be challenged with some chronic cases, life-threatening cases that you might not be patient enough to wait for the result from the laboratory. In clinics, it is accepted that you can attend to this animal or to this patient using your symptoms and clinical findings and manifestation of the patient. Then, as you look at it, you try to manage. You are not treating this time around because the result from the lab is not available yet. You are trying to manage, for example, if there is nasal discharge of the upper respiratory tract disorder. You would like to manage as you wait for the lab result. Now, it is the lab result that will now indicate to you after culture and sensitivity test from the lab. They now dictate to you the right type of antibiotics to use. These days, indiscriminate of Oxytet, and it baffles me that Oxytet, you jump Oxytet, and then you keep jumping Oxytet, and you continue putting Oxytet. And when you just decide that okay, Oxytet is not working, you go around and go to penicillin G group, and you come again, you put that, and when you think that is not working, you leave that, you go to cephalosporin group. You are just trying to make this organism to be more violent, and they will come back being highly resistant to any microbial agent that you might want to actually give. When I was publishing one of my papers, I discovered that an agent that was actually being worked on that has effect on the liver, the liver function test reaction to a Poecilotheria yohimbe, which happens to be a kind of agent that has the ability to reverse an overdose of anesthetic agent. I also discovered that Poecilotheria yohimbe has an element of an antibacterial activity. And I said, good. Now, if this has a effect or a little yes, antibacterial agent in it to which it can do this, and you are trying to reverse an overdose of an accidental overdose of an anesthetic agent, we should also look at it that one, you are reversing an agent that has a quantity of antibacterial agent. To be careful of dosing this animal with another antibacterial agent when you must have been done with your surgical procedures, or you must have been done with management of fractures or wounds or whatsoever. And I would like to say that at this junction, it is also very empirical to let us know that coming together as one body, one health, will help to stop this large or menace of antimicrobial resistance. Veterinarians coming together, the physicians coming together, the pharmacists coming together, the nurses coming together, putting heads together and trying to arrest this menace of antimicrobial resistance. It will help us to go a long way. Now, before I put a stop to this, I would like us to know that each antimicrobial agent has a target organism. Though we have broad antimicrobial agents, broad spectrum antimicrobial agents, some are narrow spectrum antimicrobial agents. So because we think they are broad, we will just use it and assume that it has gone round to take care of the microbes that might be incriminated. I'd like to say to us this day that it is a wrong practice. It is quite a wrong practice. You need to actually know exactly the antimicrobial agent to use for a certain or a particular microbial organism to be able to have a good result. And I encourage every one of us, it starts now. It starts now. A pandemic today can have a drastic turnaround and become a thing of the past by doing the right thing. I would like to say a very thank you for the organizer of this.
Thank you very much, Victor, for that wonderful presentation and clinical perspective on antimicrobial resistance. So the floor is now open for questions while the Director of Veterinary teaches us to prepare to wrap up with his comments and the vote of thanks. I will start with my own question before the students and other members ask. To the two participants, one of the medical philosophers said, and I quote, that a physician or a clinician that says, I can treat without medical laboratory results is uninformed. And a clinician or a physician that says, I cannot treat without a medical laboratory result is probably inexperienced. What is your view about that? That is question one for both of you. Floors are open for questions. So I'll take only 6 questions. Okay, 1, 2, 3, 4, 5. One more, 6. Start.
Good afternoon. Okay, good afternoon, everyone. I want to thank the organizers of this program, Dr. Nakwa, Dr. Shola, and everybody. I want to say a very big thank you because this is actually an informative. I've learned a lot. My questions. Dr. Nakwa has asked the first question. Is it advisable to
rightly and very fittingly so described as our father, the father of the faculty. other veterinarians here, and students. I want to thank Dr. Nakpa and those coordinating this meeting for considering me fit to be here in the first instance and to share the little I know with every one of us about antimicrobial resistance. Antimicrobial resistance is one of my interest areas. I work in the lab. I'm not a full-fledged academic, but this year I'm sure I've put together about 3 papers in antimicrobial resistance. I started out working on antimicrobial resistance in human clinical specimen. I have plenty of publications in that. Lately, of course, the ones I published this year were on antimicrobial resistance from resistant bacteria, antibiotic resistant bacteria isolated from estuaries, clams, lobsters, and what have you, from 2 estuaries in Cross River State, Calabar. But I honestly would want to appreciate what the World Health Organization has been doing for close to a decade now, drawing attention and placing premium emphasis on the global public health challenge posed by antimicrobial resistance. It's been aptly described as the 10th pandemic, and rightly so, because what we are going to have if we don't get all hands on deck, if we don't do the needful as a global community in waging war against antimicrobial resistant menace, is that we're going to have what has been described as superbugs. That is, infections that will emanate as a result of microbial agents, particularly bacteria, having evolved resistance, so much so that the drugs we consider today as broad spectrum, as bactericidal, would amount to naught in terms of efficacy. Treatment failure has become a very common phenomenon, both for veterinarians and physicians in hospitals. It is so because we all contribute in our own small way to the problem of antimicrobial resistance. How do antimicrobial resistance happen? What happens is that these infectious agents, particularly bacteria, that hitherto were susceptible or could be killed for literal use of word by a given antimicrobial agent or antibiotics, will evolve mechanisms to evade the activity of the antimicrobial agent. Those of you that have come through our lab as regular practicals of clinics have told us the mechanisms for the development of antimicrobial resistance. I've also told us the mechanisms for the mode of actions of the various antimicrobial agents. And so what happens is that as you continue to expose these infectious agents to one, subclinical doses of the hitherto effective antimicrobial agent, they will acclimatize to it, they will get used to it, so that when they're exposed to it, rather than die, they would not die. And why is it dangerous? The ability for microorganisms, bacteria, to develop resistance is actually very genetic. The ability to pass it on is also mediated by very many features of the bacteria, like plasmid and opsons. So it's able to transfer that gene by interaction to another bacteria. Now, what happens in veterinary practice, because that's what we're training you to do tomorrow, in this hall, we'll come for presentation, and you will hear students say, plan of action. They had started their patient on oxytetracycline, for example. If you check all the reportage here, there's hardly any time there will be discussion on antimicrobial agents used that oxytetracycline will not be incriminated. But this is the question that has not been answered. When was the last time as scientists here that we evaluated the common agents we encounter against oxytetracycline in vitro? Because it's only on such empirical data that we can predicate our continued use of such antibiotics like oxytetracycline as one of our first-line drugs. Before I did my analysis of human isolates, which I gathered from University of Abuja Teaching Hospital, Maitama District Hospital, Uniabuja General Hospital, Mpape Health Center, and Muse District Hospital, I was interested at looking at two bacteria, members of the Enterobacteriaceae, Escherichia coli and Salmonella. Why Salmonella? If you go to the hospital today, any of the hospitals in Abuja, and you have pyrexia of unknown origin, the most likely diagnosis will be that you have malaria and typhoid. Yeah. 7 or 8 out of 10 that will get that diagnosis. Most times, the diagnosis is made serologically. And so the clinician will be constrained to place you on antibiotics and will write antibiotics for you, in parentheses, empirically. For you to say you have done prescription empirically simply means that there is a periodic surveillance that has been determining resistance, MICs, of isolates common in your area. And so you have a wealth of knowledge on data that says if you have Salmonella typhi, for example, that it is susceptible to chloramphenicol. Alas, when I did that work, most, if not all, the Salmonella isolates I got were resistant to chloramphenicol. And you all do know that if you go to private hospitals, in fact, sometimes government hospitals, and they diagnose you to have enteric fever, one of the very first things they will do is to dose you with chloramphenicol. When they started noticing that because of the toxic effect, because it causes neutropenia and other, they wanted to move away, and they moved to something like amoxicillin. Now, in that same work, amoxicillin did not fare well as antibiotic of choice for the treatment of Salmonella. But I'll share some things I shared with some clinic students here. If you go across hospitals in FCT and in Nigeria, when there's a diagnosis, for example, again, of enteric fever, Salmonella, they will place you on gentamicin. You can find out. But the truth is that gentamicin is not indicated even when it is sensitive in vitro. It's not indicated. It's not one of the very first line drugs for the treatment of Salmonella because of how it is excreted. Gentamicin is potentiated in the kidneys. And that is not where your Salmonella is coming from. It's coming from the bile, and it's elaborated plenty in the GIT where it causes the disease. So it's important that as we discuss today, one of the takeaways I would want you to do is that before you make a prescription as doctors, ask yourself, am I making this prescription offhand, or is it predicated on an empirical body of data regarding the organism I suspect might be incriminated in the disease condition? Am I making that prescription on the basis of a susceptibility testing result that is before me? Because what fuels antimicrobial resistance across the world is, one, indiscriminate prescription, misuse and abuse of antimicrobial agents. What do we mean by indiscriminate prescription? Whenever you deploy antibiotics, particularly for therapeutic purposes, and it is not premised on a susceptibility test result, you are one way or the other indirectly contributing to the development of resistance. When you give a prescription and there is the patient do not comply, that particular patient would have also contributed in one way or the other in fueling resistance. Because if you continue to expose agents to sub-lethal dosing, for example, you are supposed to take 8 hourly per day, and you are supposed to take it for 1 week, and you forget and you take today, tomorrow you do not take, that is one way of exposing the organism to subclinical dosing, and it will develop resistance. Now, one other worrisome area is that there is now unbridled use of antimicrobial agents in animal production, whether it's poultry or fishing. A whole lot of antibiotics are deployed in the process. One of our postgraduate students, I think in 2019, a lady worked on antimicrobial residue from poultry products, and her findings were quite shocking as they were revealing. Because you have breakdown products of these antibiotics used to raise these birds, now finding their way to remain circulatory in humans. And as much as they remain circulatory in humans, they will now develop the gene pool that will promote resistance, even for organisms that are considered normal flora, like the organisms in the GI tree. So, one of the things we owe the world as veterinarians and those who work that attend to humanity is that under the canopy of One Health, the present campaign driven globally by WHO and driven in Nigeria locally by the National Center for Disease Control. Last year, the National Center for Disease Control conducted AMR surveillance across the country. That data has been published. It's also very, very worrisome, the finding from that particular surveillance. So what can we do? Can we come under the One Health umbrella, where we have veterinarians and physicians and all that have got to do with antibiotics be concerned by the menace posed by antimicrobial resistance, so that we can be more prudent and judicious in the use of antibiotics. One of the things we need to promote as clinicians, as you graduate to become doctors, is that before you prescribe antibiotics for any of the animals that will be brought to your clinic, insist on getting an antimicrobial result. One of the things we do which is not ethical is that we put the patient on antibiotics, whether human or animal, before resorting to doing the investigation. That has already made the investigation compromise, because it will not, most times you wouldn't be able to isolate the organism again. And not that the organism is not there, but it has become subclinical and will not express itself in the process of isolation. So one of the things we need to take away from here as we go is that when you get back to your home, your patients can walk, your parents walk across cancer. In Nigeria, antibiotics, even though it's a prescription medicine, unfortunately is considered now or is accessed as if though it's an over-the-counter drug. You walk across to any patent vendor, you walk into any pharmacy shop, people will pack with antibiotics without prescription, without a laboratory result. That is part of what is fueling antimicrobial resistance. We're worried about COVID-19 because it's a global disease. Antimicrobial resistance is also a global disease. We're lucky we could bat a vaccine for COVID-19. But I tell you, we won't be able to find a vaccine, and there will be none for antimicrobial resistance. The only vaccine is being ethical in our practice. The only vaccine is being judicious in our use of antibiotics, saying no to prescriptions that are not predicated on empirical data or on a susceptibility test result. So I want to commend those who have stepped down this celebration to our faculty. I think it's coming for the very first time, but I want to appeal that we'll make it an annual thing. Last year I did a press briefing because I was National Publicity Secretary somewhere. I had to do a press briefing about the challenge we have with antimicrobial resistance. So if we can, as people who use antibiotics, either in animal production or in care of animals, we should be in the lead. And we can also, Director VTH, extend hand of fellowship to our colleagues in the college to see if the university can really continue with the tradition of bringing people together to educate them about the dangers of antimicrobial resistance. It's a menace and we cannot fight it working together. Thank you very much.
Thank you, Dr. Ifeanyi. I'd like to say this, Director of VTH. Dr. Ifeanyi was never on the schedule for this program today. I just informed him about 20 minutes ago. I told him, Dr. Ifeanyi, I'm not tempting you. I have confidence in you that you can make a presentation in 20 minutes, and he has done that. So, to the students that are present here this morning, I encourage you to choose your mentors as you are growing up. And he's one mentor that I'm sure you can So very quickly, I would also like to invite this second speaker who told me when I informed him about an hour ago that, well, he would love to speak on the clinical aspect of antimicrobial resistance. Without hesitation, he accepted to do that, even though I bumped on him and he has accepted. Welcome, Dr. Kola.
Good afternoon, everyone. I would like to say a big thank you to Dr. Onapa that who actually invited me.
So we'll take questions after his presentation. Questions for both. Questions or comments?
Who actually invited me to speak briefly, anyway, on antimicrobial resistance. And I would like to also appreciate the presence of Director Veterinary Teaching Hospital, University of Abuja, to be part of this awareness, and also other colleagues and senior colleagues that are present. From the first speaker, you will discover from his words that is already in.
Good morning, gentlemen. I am aware that the three of you are all medical laboratory scientists working in the Faculty of Veterinary Medicine, and in essence, the Veterinary Teaching Hospital, University of Abuja. We're observing the World Antimicrobial Awareness Week 2021. Sir, as a medical lab scientist, what do you have to say about antimicrobial resistance prevention?
Okay. Antimicrobial resistance prevention is a kind of distant operation being taken in order to do away with microbial infection within the heart of animals in the farm.
Okay, thank you very much for that information. As a medical lab scientist, what are the measures you think physicians or veterinarians can take in order to forestall antimicrobial resistance?
Well, I think what needs to be done is simple. Before you apply any drug on an animal, you need to know the type of infections that the animal have that will take you to the lab to do some laboratory investigation. If not, you continue to treat animals and the drug you give will continue to resist the type of bacteria that is there. Therefore, the samples need to be taken to the lab and investigation made before you do those treatments.
Thank you very much. Have you ever heard of the World Antimicrobial Awareness Week before this time that we are observing this enlightenment campaign in the faculty?
Yes, I think it was launched last year. It was also observed.
Okay.
Just to add to what he had said before, actually, sensitivity test is crucial to curtailing all these resistances. That is, you need to identify in the lab what is the causative agent and then which drug it is sensitive to. And that will, you will be able to come out with a drug that will actually go to do the work. But when you are just using regimens of antibiotics, of course, this is a major way to cause resistance. A drug that is not supposed to be used, you are using it. And again, sometimes application matters. Using a particular antibiotic and you did not use enough dose, prescription matters.
Okay, my last question, I want a yes or no answer.
Okay.
Do the three of you really intend to spread awareness, stop resistance?
Yes.
Yes, thank you. Good morning, Dr. Hudu. I'm aware that you are the head of Department of Pharmacology and Toxicology, Faculty of Veterinary Medicine. What information do you have in your department about the World Antimicrobial Awareness Week 2021?
Well, regarding the awareness for antimicrobial resistance, you know, we are the department that handle drugs and then deals with drugs, knowledge about the drugs, administration of drugs. You know, where most of the time people go wrong is inappropriate administration of antibiotics to animals without any indication. The actual thing that's supposed to be done after diagnosis is a sensitivity test, because some people assume that after making a diagnosis that's the end, because you know the causative agent, then you take any drug and then administer. After making the diagnosis, you need to culture this organism and then find out which among the medication or drugs this organism is sensitive to. You may likely have a very good diagnosis, but because using a wrong antibiotic, you have a treatment failure. Apart from that, rampant usage of antibiotics also lead to antimicrobial resistance, because whenever you are giving subtherapeutic dose of an antibiotic, you are exposing that animal to resistance against that particular organism. You understand? Because apart from that, the duration of the treatment is also important.
Okay.
Even after making a sensitivity test, make sure that the duration of treatment is completed. Because if the duration of the treatment is supposed to last for 5 days and you're giving for only 2 days or 3 days, you're also exposing the animal to resistance. Giving subtherapeutic dose, not completing the dosage regimen is also another form of way of exposing the animals to resistance. So it will be really good after any diagnosis that sensitivity test should be done to find out the actual drug that the organism is sensitive to, and then the completion of the dosage regimen. This is what the little I have to say about it.
Thank you, Head of Department. Last question, is the curriculum for pharmacology in your department, does it cover this area extensively?
Yeah.
Okay, and students are aware of all this. Thank you for your time.
All right.
Good morning, sir.
Good morning, sir.
Can you tell me your name and your designation in this institution?
Well, John Sakimobola by name.
Okay.
And a clinician.
Okay.
In the University of Abuja.
All right. The World Health Organization and the Center for Disease Control in Nigeria and worldwide are observing 18th to 24th as the World Antimicrobial Awareness Week 2021. Do you know anything about this awareness creation, and what do you have to say?
Well, I think I got to know about this about 24 to 48 hours ago, and
And I think it's good. The awareness is okay. We need to work towards the issue of resistance that we deal with as professionals on the field, which has to do with the inappropriate use of drugs in animals. So it's right on track.
So what do you advise farmers? Even though I know in your profession, farmers hardly administer the drugs. What can you tell them about this awareness creation?
Well, it's important that farmers are also aware about this antimicrobial awareness week, because they are the ones that tend to carry out treatment by themselves, even without calling on veterinarians, and giving the dosage that is not appropriate for the condition they are trying to treat. So it's very important that they should also be aware.
Thank you, sir, for your time and for agreeing to participate in this awareness creation.
You're welcome, sir.
A word that was developed after the misuse or the misadministration of antibiotics. And these days we've discovered that the excessive use of antibiotics could lead to antimicrobial resistance. And because of the awareness in which we are trying to make people know that once you misuse antibiotics, it's likely that the infection that is targeted might not get a good result.
So how do we prevent antimicrobial resistance?
Thank you very much. Well, antimicrobial resistance can be prevented by doing a very good laboratory test to be able to get the type of bacteria we are dealing with. Then thereafter a sensitivity test to give us the drug that is actually resistant or will take care of the bacteria that is actually incriminated in a certain condition.
Okay, thank you, sir, for participating in the World Antimicrobial and Antibiotic Awareness Creation Week 2021. Thank you.
It's a pleasure. Thank you.
Right. Good morning. Can you tell me your name and what your designation is in this institution?
My name is Praise Okonkwo. I'm a veterinary student in VTH.
Can you read what you have in the flyer in your hand?
Okay. World Antimicrobial Awareness Week 2021. The theme: spread awareness, stop resistance.
Okay, what do you understand by spreading awareness and stopping resistance?
Spreading awareness means enlightening people on a particular dangers of abuse.
Now this video is going to WHO and you have to say something. Can you assist her?
Okay, it means spreading awareness on antimicrobial resistance, hence stopping resistance through the information that we give people. So we need to let them know that they need to use the right antimicrobial agent for the right organism. So hence they need to perform antimicrobial susceptibility tests before administering a drug, and hence they need to stop the abuse of antibiotics and antimicrobial drugs.
Thank you. There are instances where people take antibiotics unnecessarily.